For our next topic, I want to go over something that will hopefully help you handle some of the anxiety and stress that you're going through as you see these cases rise day to day. And that is, how do you handle the numbers as they come out, and how do you take real meaning out of that? So what you have to understand first is that we don't have enough tests to test everybody. We are only testing those that are really sick, at high risk, and have other parts of their history that would warrant getting a test. So what that means is we are selecting for people that are already significantly symptomatic, and then if they're testing positive, those people are more likely than not to maybe need hospitalization, ventilation, and possibly not making it. Now, if we were able to test everybody, and what we know about this virus is that 80% of us get no symptoms and are actually spreading the virus without us knowing, you get a much, much higher number as far as the incidences go. So what I would say to you is what I do is I don't look at the incident rate. I look at the death rate, how many people have died. And the incident rate to me is not something that you can take any meaning from right now because we're not able to test on a wide scale. So if you look at Germany, they're strategically testing everybody who is either sick or come in contact with a sick person. Currently, what they're finding is their death rate to incident rate is about 0.4%, which is essentially a really bad flu. But we're not going to know that until we have wide-scale testing available. So what I would say to you is assume that you've been exposed. If you don't have symptoms, assume that you're spreading it, and then take those social distancing actions to try not to give it to other people. Don't look at the incident rate and panic. We really need to look at how many people are not making it. And the key to that is we can't overload our health system. So if we have enough ventilators and we have enough nurses and doctors to care for them, we have a really good chance of being like Germany and not like Italy. If we don't heed the warnings and we don't do the distancing and we allow it to spread through the non-symptomatic people to people that are symptomatic, then we have a chance of running out of ventilators and running out of beds and running out of healthcare workers. So what I would say to you is it's important to keep in the loop, but don't let these skyrocketing numbers scare you, because actually if we get all kinds of numbers climbing, once we get enough tests, and we can keep that death rate down to here, then ultimately we're going to come out like Germany and not like Italy. So for the next couple of weeks, try to stay calm when you see these numbers going up, because tests are coming up, they're going to go up. And just go back to the rules of social distancing, staying as healthy as you can, not engaging in anything that's going to hurt your lungs. And week to week, we'll keep giving you information to take with you. And hopefully in a couple of months, we'll be in a much better place.